Hey guys, so the next skill we're going to do is IV piggyback. So the day you come in for check-off, you will draw an armband just like you did for MeditMen, and you will select the appropriate orders MAR, and you will also get some labels. So I've made sure that all of that matches. I'm making sure for this room I have the appropriate supplies. I need a pair of gloves, I need my piggyback, and I need my tubing. Okay, so the first thing I'm going to do is I'm going to verify all of this. Okay, so my IV piggyback is levofloxacin 250 milligrams IV piggyback daily. My MAR says levofloxacin 250 milligrams IV piggyback daily. However, I noticed that the indication is missing on both the orders and the MAR. So what I'm going to have to do is I'm going to have to call the physician and have him verify what this patient is receiving this medication for, and then it can be fixed on both the orders and the MAR. Okay, so the next thing I'm going to do is I'm ready to look my medicine up. Okay, so I've got my drug book. I already have it marked because I know that that's going to make my life a lot easier. I'm looking up levofloxacin. I see that it is an anti-infective. It is for various different types of infections. It is contraindicated in people who have a hypersensitivity to quinolones. The adverse effects, the biggest one are seizures, QT prolongation, some GI effects like C. diff can happen. It can cause hemolytic anemia. It can cause rhabdomyolysis. And Miss Kelly's telling me that that's good for side effects. So now I'm looking at nursing assessment. I'm going to assess my patient to see if they've ever had a reaction to quinolones. My patient has no known allergies documented, so I should be good there. I'm also going to make sure, because it's an antibiotic, that there is no cross reaction, but since my patient has no allergies, I don't have to worry about that. So I'm going to assess my patient for signs and symptoms of infection. I'm going to check lab values like a white blood cell count. I'm also going to make sure I obtain any labs or cultures that I need before I ever initiate antibiotic therapy. And I'm also going to watch this patient, their ECG or their EKG, to make sure they don't have a QT prolongation. That's to do with their heart rhythm. And so that's just one of the things that can happen I want to monitor for. So I know that this is a piggyback. So in your drug book, it's going to be under intermittent IV infusion. So that's what you're looking for, intermittent IV. So my book says to infuse doses of less than 500 milligrams over 60 minutes, okay? And that is what I have. My order is for 250 milligrams. So my time is what I'm looking for, that's 60 minutes. The day of checkoff, you also are going to need a drop factor. The drop factor will be given to you by your instructor. Miss Kelly has given me my drop factor, and it is 10 drops per minute. Okay, so I'm going to write that down on my MAR so that I know when it's time to do math what my drop factor is. One more thing that I'm going to look for in my book when I'm giving IV medications is compatibilities. So I know that my patient's supposed to have normal saline running in their IV continuously. I'm going to make sure that I check for that and that it's correct when I go in the room. And I'm also going to check in my drug book to make sure that levofloxacin and normal saline are compatible. And under my compatibilities, it does have normal saline. So that means that they are compatible, and I'm good. I'm done with the drug book, okay? So now I'm going to pull my medicine. I'm going to go ahead and get it out. And I'm going to look at my label. I'm supposed to have 250 milligrams in 50 milliliters. I'm checking my bag. It is 250 milligrams in 50 milliliters, okay? Now I'm ready to do my math. I know that my drop factor is 10, so you're going to learn how to do this in class and with dosage calc. After I did my math, my drops came to 8.33 drops per minute. You're going to round to the nearest whole number using regular rounding rules. So that's going to be 8 drops per minute, okay? I'm going to write that down somewhere so that I have it even when I go in the patient's room to make sure that I get it right, okay? So before I leave the med room, I've got to check my medicine for my second med check. So this is levofloxacin 250 milligrams in 50 milliliters, okay? So now I'm ready to go in my patient's room. I've got my gloves, my medicine, my tubing, and I'm also going to grab an alcohol prep pad to clean the tubing that's already hanging in the room. All right, I'm going to come in the room. I'm going to say, hello, Mr. Dunn. My name is Caitlin. I'm going to be your nurse today. I'm going to be giving you an IV Piggyback antibiotic. I'm going to check my patient's armband, and this is Joe Dunn. Date of birth is 5/2/19XX. Do you have any allergies? He says no, and the armband says no, okay? So now I'm ready to go ahead and check my medicine one last time, my third med check at the bedside, and this is levofloxacin, 250 milligrams in 50 milliliters. And I know that I'm going to be doing 8 drops per minute. Okay, so now I'm ready to go over here. I'm going to do hand hygiene. I'm going to apply my gloves. Alright, so when you come in the room, your primary is just going to be hanging just like this. You're going to have this little drop down thing that comes in your kit with your tubing. When you open your tubing, just go ahead and drop your primary down, because you know you have to do that, and so you don't forget it. Just go ahead and do that, because if you don't do this, your drop factor is going to be off and it may not even drip at all. Okay, so the next thing I'm going to do, I'm going to hang my Piggyback up here. You can spike your bag either while it's hanging or while you're holding it, whatever you're most comfortable with. There's not a right or a wrong way to do that. So I'm going to get my tubing out, and I'm going to make sure it is clamped, because if it is not, it is going to get all over you, okay? So I'm going to pull this clear piece off of here. This bag has been open before, so I'm going to have to spike it like this, and a lot of yours are probably going to be like that. If you have ever spiked the bag before and it's not a brand new bag, you have to spike it while holding it upside down, or all your fluid will come out. The only time you can spike it while it's hanging up here is if it's a brand new unopened bag. So I spiked it. I'm going to fill my chamber 3/4 of the way. And now I have to prime this tubing before I connect to my primary. So this is already primed, but what you do is you're going to open up your roller clamp, and it comes quickly. So if you're scared you're going to make a mess, do it over the sink or over the garbage can in the room, please, okay? Once I've got it primed, I'm going to clamp it off. I'm going to get my alcohol swab. I'm going to now connect to the port closest to the bag. Do not try to connect this to the port way down here. One, it doesn't reach, and if it looks funny, then it probably is funny, okay? So you're going to clean this port. You're going to take your cap off without contaminating. You're going to connect the two. All right, so the next thing I've got to do is I've got to open up this secondary roller clamp all the way up, okay? This has to be all the way up, or your drops aren't going to flow and it's not going to be accurate. But now I need to count my drops. I'm going to make sure all my clamps are open. But to count your drops, you need to use this roller clamp here. And I recommend rolling it on up here to where it's about at waist height. You're going to have your watch, your plain old watch. You can't use a smartwatch. You're going to hold it in this hand right here, and you're going to control with this hand. You have to control your drop factor with this hand, okay? Not the secondary, okay? Secondary's wide open, and now I'm going to count my drops. I've got my watch here. I'm going to open this roller clamp up until I start seeing it flow. I'm looking at the secondary drip chamber. This is where you're looking to count your drops. That's pretty fast, so I'm going to slow it down. I've got my watch and I'm counting. And I'm going to stand here and I'm going to count until I get 8 drops per minute. If you start getting scared, you run out of time, you can multiply it times 15 seconds, 30 seconds. But before you do your final answer, I highly recommend counting it for a full minute if you have the time, okay? So now, once I have the time, I'm going to tell Miss Kelly, okay, I am ready for you to count my drops. I'm going to make sure that I have my patient in the lowest position. They have their call light in reach. I'm going to make sure I check on them. I'm going to do hand hygiene and take my gloves off. Once I tell Miss Kelly that I'm ready, your checkoff is over, okay? So you can't fix anything once you tell us that's your final answer. What we'll do is we'll come over here with the same watch that you utilize. We will stand here and we are not going to mess with this. We're going to count exactly how many drops per minute you have, okay? So you can have 2 drops up or 2 drops below and you will pass. So I had 8 drops per minute. If I would have gotten 6 drops per minute or 10 drops per minute, I would have passed this check off. And that is all for IV Piggyback.